sure what's going on, but there were some audio issues, definitely.
Yeah.
Seemed like it was on Kimon's end.
Ryan Gear here. Sounds better for me too.
Yeah,
So
Moshe's here as well.
Yeah, the static sound is gone, but also Kimon's gone too, apparently.
Yeah. Right, sorry about that, guys. Kimon was having technical difficulties, obviously, but he will be rebooting and starting right back.
Hi, this is Mike Bordenaro from the Asset Leadership Network. And while we're sorting out our technical difficulties, we'd like to thank you for your patience. And we're just going to do a talk through until we get the visuals. So the Asset Leadership Network is very proud to be co-hosting this despite the technical difficulties, along with the National Institute of Building Sciences and Onuma Inc. What we're doing is showing how to use web services and web processes that have been proven over years in our business processes. Part of that is dealing with technical difficulties, which has happened all the years that we've been doing this. But I'd like to introduce Roger Grant from the National Institute of Building Sciences, which had an excellent webinar today. And Roger, will you talk a little bit about the difference between what you did earlier today and how this interactive workshop webinar series is in your mind?
Sure, Mike. Hello, everyone. Yeah, like Mike, apologize for the technical difficulties, but all of us know it's part of the territory these days, dealing with using our systems in different ways, and all hoping the internet stays caught up with us. Yeah, the National Institute of Building Sciences is pleased to be a co-sponsor along with Asset Leadership Network and Onuma. NIB's mission is to work with the government and with the private sector to address a whole range of different challenges around how buildings and infrastructure provide safe, secure, and high-performing environments for the people that use them, for the citizens of the United States. We're pleased to be involved in this session, which is looking at how can we collaboratively use information and technologies together to address problems. And we all know we have unique problems right now that we need to address, and we're really excited about the collaborative way we can come together to help address those problems and get people using what's available out there to come up with solutions. So we have worked with Onuma, helping federal government agencies identify how to use information as an asset and make things available to be used, and find things that are available and use them. And that's the theme of what's going on here in these webinars that Kimon has put together. And the webinars are summarizing the working sessions that are going on at the same time. So that's what we're going to hear about today, is some of that work.
It seems like Kimon is back. Are you back, Kimon?
Yes, I am. Sorry about that. Can you hear me okay?
Yes.
Great. So I don't know how far you guys got in introductions. Roger, thanks for that intro and overview. We were talking about the speakers. I don't know if you heard me introducing Grant Thornton, but they'll be coming up later. Kevin.
No, we did not hear anything, Kimon.
Wow.
The audio went total static as soon as we went live. So if you want to say what you were going to say about Grant Thornton, then we'll be right back on track, although a little behind schedule.
Okay. Well, thanks for putting up with the technology, but thank you to Grant Thornton for being here today to present to us what they are doing. Some really exciting work. Kevin, Richard, and Moshe will be speaking later, so we'd like to welcome them. And we have kind of an overview. We've been using this slide to present the idea that we're looking at the entire life cycle of facilities. And there's been a lot other webinars that have been recorded and posted. So I encourage those that are listening today, if they haven't seen the previous webinars, to see the short presentations that give you a background of how we got to this point. We have Arthur Curlin from University Health System with us here today as well as CHOC, Children's Hospital of Orange County. And let's just get right on with it. So real quickly, we were looking at COVID responses, and there are companies out there that are building solutions, really unique solutions on how do you build these rapid response kind of facilities for Jupe, for example, has a healthcare module that you can load on a truck and move around the country and set them up really quickly. They're kind of fancy tents, but with all the systems in place to support healthcare. And there's another open source project from Italy that's really interesting. That was Curopods, and they're actually building these now. They're built inside containers, and these seemed interesting to us too. So we were able to get online and actually build up modules of these in BIM, and using a process that was developed at NIBS for the Department of Veterans Affairs on how do you define requirements and then rapidly build up a plan for a hospital. And one idea was, can we even stack these units? We're not even sure how high up we can go, but we tried it out. We used the prototypical layout that was posted from Curopods and built a BIM out of that. And then Arthur Curlin from University Health suggested we land this on a facility that they have in San Antonio. So we did a quick layout in one of the workshops, got to this point and said, okay, what do we think about this? Does this even make sense? So the design is not complete, and that's the idea behind BIMStorm, is to get to rapid interaction and getting input from participants and say, well, we need a helicopter pad here, for example, Arthur mentioned. And after we finished one of these workshops, we said, okay, now we have this initial layout, we can move it to other locations. And Arthur, you had a comment at one point that we should start even tracking patient counts and staffing inside the facility so we can project over time how is the supply meeting the demand. I don't know if you'd like to say a few words about that, but that was one of your comments at the workshop. Arthur, if you're on, would you like to say something about that?
Yes, just at a high level, we were really discussing the real property and the personal property, but we weren't discussing the effects on the human asset. So that was what was prompted the question.
Yeah, perfect. Yeah, and that's actually interesting because it ties into what Grant Thornton's going to be talking about next. Is if you have the human factor in it, how many patients do you have, for example, directly starts impacting how many beds do you have, how many PPEs do you have, do we have enough to support this activity? And that's why I thought this was an interesting tie-in to what Grant Thornton's going to be talking about. So everything is interconnected. As an architect, we're typically thinking about facilities and design, all important things, but there's also the logistical part of how do we actually run this and make it work. Another part that we talked about in one of the workshops was the cost. So as we were building up these BIMs, we were starting to generate very rough initial cost. It wasn't anything down to the last detail, but using the numbers that came from Curopods as far as how much is each container cost to actually construct these. And another comment that I believe, Art, you brought up too, and others were talking about, was what if we look at this from a rent or lease perspective instead of construct, especially since these would not be needed. We would need to decommission them after 6 months or 9 months, or when the need is no longer there, and move them to another location. Like we actually use Washington, D.C. So we said, okay, what do we look at like that? So as we start building up these BIMs, we can actually start getting other experts in that do cost estimating, for example, and use GIS, for example, to start saying, where else can we put these facilities? So we started setting up scenarios during the workshop. Very quick. This was just like 30-minute, one hour type exercise of let's move from San Antonio, now pack them up and move them to Washington, D.C. If you look at the demand curves that were on the Esri site, actually, that showed how many patient and ICU counts do we need in different parts of the country. And obviously, we're all in the middle of all this right now. It's happening right now, but we're also planning for the future. How do we create connections between different parts of the industry to be able to rapidly respond and say, okay, now what if we move them to the Children's Hospital in Orange County? So we took the exact same layouts. We took a few floors off and said, well, maybe you only need 4 or 5 floors of these units. This might not even work from an engineering perspective. We still need input from that. But we landed them on this random site that we saw open in the Children's Hospital in Orange County. And Ryan and Tiffany, I believe you're on. What do you think of this site? This happened last night, actually.
Right, you sent it to me, and I started acting as if I was one of the planners for the hospital, and noticed I know this site. It's far away from the front door, so suggested another location and something that a little more accessible to some of the central services. And there's actually 2 hospitals here, St. Joe's and Chalk. So I outlined 1, 2, 3, 4 places other than the one with the X. So I think you came up with something, Kimon?
Yeah, we're going to show it later. We're going to do a little bit more work while Grant Thornton's presenting.
Okay.
But yeah, this is interesting from a location perspective. We quickly just landed it here. So the geospatial location using Google Earth here in this case, and then you hand sketched over it a perfect BIM, a building information model location, which is actually a good example. It doesn't always have to look pretty as long as we can communicate this is where we want to go. So the next part of this will be to, let's see if we can land it in these new locations. Would they make any more sense? So leading into Grant Thornton now, I think what's interesting about this scenario, if you look at a hospital complex like this, there's obviously the need for facilities, but there's also the need for PPEs in a COVID response scenario. And imagine all the hospitals around the country and the world. So I'd like Grant Thornton to present to us what they do and how they would respond to something like this. This is an interesting angle to the BIMStorm now. Welcome. Thanks for joining us.
Yeah, thank you. Thank you so much, Kimon. My name is Moshe Nelson. I'm the Asset Management Solution Lead for Grant Thornton Public Sector. I'm just going to talk for a few seconds about Grant Thornton globally in the United States, and then we're going to jump right into our experience, particularly with this area. I'm joined with our director with our digital transformation and management service line, who oversees resource optimization, as well as a subject matter expert, and I'll be speaking a little bit later. Grant Thornton globally is, north of around 50,000 people. We're over 130 countries. We're a full-service accounting, advisory, and audit firm with significant expertise in multiple areas. And asset management is one in particular that we'll speak about today. Next slide. So just a little bit of statistics within the United States. We are in most major cities throughout the United States, around 57 offices, around actually north of 7,000 individuals. For those that are joining from the federal government, the Beltway area, we have around 1,000 public sector advisory consultants within the Beltway, as well as located in major metropolitan cities, big presence in California, as well as San Antonio and Florida. Next slide. So I wanted to take a moment to speak about some of the challenges we're seeing with clients in the public and private sector when it comes to the COVID-19 response. We've been lucky enough to be called upon to help both public and private sector, organizations battle the pandemic from an entire supply chain and resource management perspective. So what we've done is gleaned a few, overarching challenges and developed solutions that address these challenges, and you're going to see them very shortly. A few challenges for PPE is the inability, since it's a consumable, to, in many cases, track inventory, manage the data in a standardized fashion across multiple organizations, whether that's state specific or the United States, or even within one company, as well as different processes and skill sets and facility storage that exist, within a specific organization's environment. There's just significant differentiation, and when COVID-19 spun up, we saw all of this compound. So what happens as a result of this is the inability to analyze, resource, and plan very rapidly to address spikes and changes in demand and need. What you'll see in just a moment are many of the tools that we've developed help manage this entire life cycle to ensure that hospitals, government agencies, and organizations can manage, predict, and allocate resources effectively to address the COVID-19 challenge. Next slide. So just very quickly, you'll see there's 3 different tools that we have here, one specific to the inventory, collection and management, and allocation of these assets. And what we'll be speaking about in depth is this network optimization. So at this point, my colleague Richard McCormack is going to bring up one of the tools that we have for inventory tracking.
Okay, so we'll switch over to Richard.
I'll provide the talking points very quickly on this while Richard drives. So this specific tool is looking at the inventory management and prediction of PPE. You'll see, 3 notional areas of San Antonio, Children's National Medical in DC, as well as another location. We geographically differentiate this across the United States and are able to show, what the quantity levels are at hand, what is needed in the future, and then how the procurement may be managed for PPE, whether it's through contracts or purchase agreements. What this does is enable, better analytics and planning for budgeting, future demand forecasting, and the like. The next dashboard that we'll show here quickly is just, weekly trends for the particular, 6 PPE items in this case, so that, by location, you can start to see what the burn rate may be to be able to better predict budget allocation needs, future changes, and, oversight from the organization's specific activities. A small note on the bottom are reporting regions, which is fairly important for many large organizations where there's differentiation in ability to collect and report data, ultimately to use for analysis. So we actually have enabled clients to track this and then follow up to ensure that you have a comprehensive picture. I'm now going to turn it entirely over to Richard to walk us through the optimization piece that helps with allocating in different facilities.
All right, thanks, Moshe, and good afternoon, everyone. My name is Rich McCormack. I'm a manager in the resource optimization group at Grant Thornton. We developed an optimization tool to support decision making around critical asset allocation. The concept of this really applies to any limited resource, from PPE to ventilators, hospital beds, even human resources, across a network of systems, entities across a network. The example that I'm going to run through today is ventilator allocation and redistribution across a hospital system. The concept being, right, that an entity in a system is going to have a starting inventory of a resource, in this case, invasive ventilators. However, there is a curve. Healthcare modeling provides those curves. They were alluded to earlier in the presentation. And those curves are unique to each location. And these are done by healthcare modeling organizations that help provide decision support. And this is one way that you can utilize the outputs of those modeling efforts. As we move up that demand curve, we know that we need to add inventory to the system. And after we've reached our peak, we know that we may have surplus units, especially and obviously for these reusable materials, human resources, ventilators, hospital beds, that can be redistributed across a network of locations. And those peaks will hit